Hi, my name is Emma Fritsch. From the front, I may look like a normal girl, but this is my back. Well, when I was in third grade, I remember the nurse noticed a curve in my sister's spine, but that's usually natural for most people. So they suggested she go to get it checked out, and I went with her. And although she was fine, they suggested I see a specialist, so I did. And it turns out I had scoliosis with a 30-degree curve in my spine. In order to prevent the curve from getting worse, I would have to wear a bulky back brace under my clothes for 20 hours a day, every day, until I hit puberty. Well, when I didn't wear the brace, I remember I liked to have it off because I felt more, free and normal. But eventually, after the allotted time for 4 hours that I was supposed to have it, I'm allowed to have it off for 4 hours. But then if I had it off for longer than that, I would get this really intense pain right in my upper back. And it kind of felt like it was caving in. So I used to try to adjust it, but it just didn't work if I didn't put the brace back on. The curve was in my upper spine, from the vertebrae T2 to T12. When I was in 7th grade, I went back to Dr. Rigger for my normal checkup, and I remember he told me that the curve in my spine was approaching 40 degrees. And when I first went to him, he said if it ever went to 40 degrees, I would need surgery. So he suggested I get the surgery sooner than later. So I ended up getting the surgery that summer. And when I found out I needed it, it was kind of devastating because I wore the brace for 4 years of my life and it was useless. It went to waste all that time.
I received my medical degree back in 1983 and started my training in orthopedics in 1984. I've been performing spine surgery since 1985 and as a private attending, doing surgery where I take responsibility for the child's health and well-being since 1989. Since starting practice, performing surgery, I've been very fortunate to become a member of the Scoliosis Research Society, in which I've demonstrated certain skill and knowledge level in scoliosis. And because of that, my practice, a significant part of my practice is spinal deformity. And so I've done hundreds of scoliosis surgeries since starting my career. So scoliosis surgery is required in individuals who have a curvature of the spine. The spine should be straight up and down like a staircase, and when you have scoliosis, it looks like a spiral staircase. So as the spine twists, we try to prevent the progression of the curve with the use of brace and sometimes therapy, physical therapy, where if it continues to progress, as the spine twists, the organs will get twisted and it'll cause issues with the heart, the lungs, and other organ systems. So when a curve gets past 40 degrees, we know that it will progress into adult life, and that's when a physician will start considering having performing surgery on a child who has scoliosis. When we go into surgery, there's many components of the surgery. The first part is, even before we start surgery, for about an hour, is what we call preparation. In that time, the anesthesiologist will perform certain procedures, such as securing the airway, going ahead and putting IVs in to secure access to get fluids and medications. Also, there's a line put in an artery called an arterial line to evaluate blood pressure, because there's a lot of fluid monitoring to make sure appropriate amounts of fluids given surgery. There's electrophysiology studies done prior to the procedure and during the procedure. That's where electrodes are placed in various different parts of the body to make sure that as we move the spine, this electrical impulses up and down the spine are continuing to function, and we know that we're not injuring the spinal cord. And after that's completed, the patient is put on a table with their face down so we can see where their spine is. And then we separate the muscle from the bone, and once we see the bone, we carefully will go ahead and find out specific areas of bone where we can make little holes and then place screws into the spine. So the spine is made up of several blocks, and we place several screws in the various different blocks. that form the curve and attach that to a rod. And then when that rod is attached to the screws, we would go ahead and manipulate the rod and the spine to straighten out the spine. We correct it about 50% because we know if we correct the spine greater than 50%, it can injure the spinal cord. And during that procedure, we work very closely with the anesthesiologist and the electrophysiologist, the person that's looking at the spinal cord, to make sure that everything is going well. Then afterwards, we'll put a drain in, usually, then close up the muscle with sutures, and then close the skin up and put a dressing on. We'll monitor the child in the operating room until we know that neurologically they're intact, meaning they're able to listen to our commands and move their fingers and their toes. And once we know that they're comfortable, then we will go ahead and transfer the patient to the recovery room, and the next part of their recovery begins.
So the surgery was scheduled for July 10th. So since I would be out for the rest of the summer, I had like an entire week planned out with my friends to do just a bunch of fun stuff, go swimming, just like a summer in a week basically. And I would be having the surgery at NYU, so it's a really good hospital, and I'd be operated on by Dr. Rieger and Dr. Errico, who are professionals and are very good at what they do. So then time flew by, and it was time for the pre-surgical testing. I talked to a really nice nurse who explained a lot to me about the tests we would have to do and what the surgery would be like. I don't think people like him realized how much their kindness helped me, and I want to thank them by giving back in the future in any way possible. They took x-rays so I could see what my back looked like before they put the rods in. I had to take a breathing test to see what my lung capacity was before I got surgery. I also had to have blood taken to make sure I was healthy. My parents both gave blood so that if I needed extra blood during the surgery, I could get it from my parents before they pulled it from the blood banks. Luckily, both my parents have the same blood type as I do. I was so nervous, I'll be honest with you, because I never had surgery before and I didn't even know what to do with myself. But I remember leading up to it, I had to use these sterile wipes to make sure I was clean, so when they operated on me, I wouldn't get any infections. And then the night before the surgery, I couldn't eat or drink after midnight. But I couldn't really eat anyway because I was so nervous. I thought I wasn't nervous. I was trying to keep my spirits up. I was being goofy in the prep room, and both my parents were allowed in with me. But when they laid me on the table for anesthesia, my stomach dropped. This was real. It was happening. It wasn't some crazy nightmare. Was I going to be okay?
The surgery can vary for as short as 2.5 hours up to 6, sometimes even longer. The reason that I can't give you a specific answer on how long surgery takes, it depends on how severe the curve is. Sometimes there's a simple, what we call C curve. Sometimes it's an S curve, where there's 2 curves that we have to deal with. Sometimes there's other issues in which there's abnormalities of the spine, so the bones are not formed properly. And in those situations, we have to take great care in order to place our instruments around the spine carefully and safely to protect the spine. So depending on how complex the curve is, it can take as short as 2.5 hours or as long as 6 hours. During the operation, as I had stated, we monitor the spine. There are 2 potential devastating complications during the procedure. One is when we place the screws into the vertebral body, the blocks of bone. If we go too far anteriorly in the front of the spine, there are large blood vessels which can be injured, or a lung can be collapsed. So if a major artery is injured or a lung is collapsed, we have to close up immediately, flip the child over, and then go ahead and repair those damaged vital structures. Fortunately, in my lifetime, that's never happened, but we are always prepared for the worst in case, God forbid, something does happen. The other issues which can occur is when we manipulate the spine, we notice that what we call the signals of the spine are decreasing, so the spinal cord is not responding properly and demonstrating signs that it's being stressed and damaged. In those situations, what we'll immediately do is remove any stress on the spine and take all the motion, reverse all the procedures that we did to take the spine from going straight and allow it to bend a little bit, because most of the time these issues are related to poor blood supply to the spine when we stretch it. So those are the major issues, and there's protocols that we follow if any of these to happen in the operating room.
Well, during the surgery, even though I didn't know what was going on, there was actually a complication where they screwed the titanium rods into my spine too tight, I guess, and it hit a nerve and I lost all of my motor functions for 10 minutes. That's what they told my parents, at least. And they're good at what they do, and they fixed it as soon as possible, and then I was fine after that.
Emmy, can you hear Daddy? Can you hear me? Did you hear us talking about you just now? Did you? She's not coming out of it. See, she's goofing on us.
She's doing it on purpose.
She's doing it on purpose now.
Emma.
Off section.
Hi.
Hi. Hi, beautiful. That's my baby.
I don't really remember much in the days after the surgery. I just remember being in the recovery room. My family was there. I remember blue curtains, a nurse with red hair, and that's about it. I just remember being in so much pain, I didn't even want to open my eyes. And I'm not going to water it down. It was the worst pain you could ever imagine.
After the surgery, the patients are monitored for about a day, and it's very important to get them walking because the systems of the body, like the lungs and the heart and the bowel, work better when a person is in motion. So generally on the post-op day number 1, the following day after surgery, we ask physical therapy to come and see the patient. What physical therapy will do is they'll instruct the patient how to move properly. Moving properly means 2 things. One is in such a way that it minimizes the pain that a patient would have when moving, and also helps them to balance themselves and learn how to walk again because their body has actually been altered after the surgery.
I had to sit up the day after the surgery. It hurt a lot, and I really didn't want to do it, but I kind of didn't have a choice. They had me on morphine to keep the pain at ease as much as they could, and they gave me a little button where I clicked it and the medicine would be coming into my IV, but I was only allowed to click the button every 5 minutes, even though I just wanted to keep tapping it. It didn't do anything. I took my first steps 2 days after the surgery. Walking was the hardest. My back felt like 1,000 extra pounds were weighing me down. It made the movement of my limbs seem impossibly hard. The sight of the scar felt like someone was pressing a hot poker into my skin. It's hard to explain, but it hurt. They said the scar would heal really well, but I had to keep it out of the sun. I also had the blood drains in my back to get rid of all the excess blood, which was pretty gross to look at. Normally, you are in the hospital for 3 to 5 days, but I had a problem with my bladder adjusting after the surgery. I basically couldn't go to the bathroom, and they had to drain my bladder when it got full. I thought to myself, I could never relive this. Recovery was hard, and I was in the hospital for about a week. I had to constantly keep moving, even though it hurt. But eventually, I started to get better at walking and sitting up. The pain started getting better and more manageable. Soon enough, I was able to get dressed by myself, thank goodness. Walking also got easier. Steps were a little and awkward, but I did it. I was able to go to the bathroom by myself again. And after 7 days, they told me I could finally go home. Going home was one of the hardest parts. Never mind just getting in the car, but the car ride itself was brutal. We surrounded my seat with pillows to try and ease the pain, but every bump and every turn hurt. But when I got home, I couldn't be more relieved.
After surgery, the recovery period is generally about 6 months. The first is the acute phase, which is the hospital phase, which is about 5 days. The patient's generally brought up to the recovery room after the surgery and then into the intensive care unit for a day. They'll stay on the floor for about 4 days, in which they learn how to eat again, walk again, and feel more comfortable and can be cared for by themselves when they get home generally. After that, the next couple weeks, we try to get the children to increase their ability to walk and get their endurance up. Usually, because the recovery and of the body takes a while after this major surgery, they can return to school activities about 4 to 6 weeks post-operatively. As far as activities and sports, we generally do not allow the patients to return to sporting activities until about 6 months after surgery. That's because during that time, the instruments are holding the spine together, and if the spine is twisted in such a way, sometimes the instruments can loosen up. At about 6 months after the procedure, the instruments are really not holding the spine very effectively anymore because the bone has now fused and the spine is now solid, and the instruments are superfluous. In about 6 months, the children feel very good and can return to sporting activities. And actually, sometimes we actually have to encourage the patients not to return to activities prior to 6 months because the reason for that is they feel so good they want to go back, but we know from a standpoint of healing that they need a little bit extra time. Well, during the first 6 months of the recovery period, we really generally use what's known as the BLT rule, bending, lifting, twisting. We don't like them to bend forward. We like them to bend with their knees. We don't like them to lift heavy objects away from their body. We like it close to their body. And when they turn, we like them to turn their body, not twist their body. This puts less stress on the implants that we place on the spine. After the patient is sent home from the hospital, physical therapy is generally not required. However, some children do need a little bit of encouragement to continue their recovery, and in those cases we will ask for these children to go to physical therapy, generally to condition themselves and increase in their endurance. But most children just will go ahead and start walking more and more after the surgery, and most patients will not need physical therapy after the surgical procedure. With regards to the scar after the procedure, they have to keep it covered for about 2 weeks and to prevent any type of wound infection. After that point, it needs to remain out of the sun for about a year because the ultraviolet light can cause the scar to spread, and we'd like to keep it as cosmetically pleasant as possible. In addition, sometimes there can be other issues that develop with the scar where it becomes very thick, and there's certain creams and certain interventions with either a plastic surgeon or a dermatologist that can minimize that type of scarring. And I should note that this type of scarring issue is very uncommon after the surgery. Generally, the patient is discharged at 5 days post-operatively. We generally like to see the patients at 2 weeks after the procedure or 10 to 14 days after the procedure. Of course, we're looking at the wound. That's the most common time a wound infection would occur, and we would see redness and swelling and sometimes discharge from the wound. That's very rare that happens, but we want to catch that early. So 2 weeks is usually the first post-operative visit in the office. We'll then see the patients generally at 6 weeks post-operatively, 3 months, 6 months, 9 months, and 12 months post-operatively. Then it's year and a half and then 2 years post-operatively, then yearly after that until 5 years post-op. And we do that in order to monitor the spine to see that it's fusing properly, and also to see that the patient has returned to normal activities and they're not developing any type of delayed issues after this type of surgery.
They kept me on like a bunch of painkillers and different medications, but quite frankly, they made me feel all nauseous and fuzzy, and like I wasn't in my own mind, so I just took Tylenol and dealt with the pain. I wasn't allowed to get my scar wet, so I tried using dry shampoo and all that, but it didn't work out too well. So I lay down on a lawn chair with my head hanging off the end, and my mom washed my hair with a watering can. It actually felt much better once my hair was clean and brushed. Now that I look back, it seems pretty funny. I also had to change the dressing on my scar a few times, but the nurses taught my mom how to do it, so it wasn't really an issue. I was really insecure about the giant scar at first, but I started to become proud of what I went through. After the surgery, I grew almost 1.5 inches. It's pretty self-explanatory how that happened. If you straighten your spine out, you're obviously going to grow. The rods in my back are titanium. They don't ever get removed. I'll have great posture for the rest of my life, and I can sing the song Titanium with a very literal meaning. So during the recovery, I was out for 6 months, but I would be going back to the doctor every 3, I believe, to get a checkup and to just make sure everything was going smoothly and it was fusing correctly. But during that recovery, I wasn't allowed to bend, lift, or twist anything. So obviously I wasn't allowed to do any sports, which was really hard because my life used to revolve around sports. I used to be a gymnast and played basketball and did all these activities where I had to move around a lot, but I wasn't allowed to do that anymore, so it was torturous. After about 6 months of doing no sports and finding relief in music, I went back to the doctor and I was finally cleared and I felt like the happiest person ever. So I went back to sports, which was hard because I've been out for so long, for about 2 months. And then when I went back to the doctor, I don't know exactly why, but I was told I needed surgery again, and I didn't know what to think. I just remember crying so hard on the drive home. Because imagine someone telling you you had to relive the worst pain you've ever felt. How would you feel? I don't know how you would feel, but I was so angry because I went through it once, and isn't that enough? But I was also relieved because I knew what was coming, and I knew that I could, if I went through it once, I could go through it again. And I was just scared because there was complications in the first one, and I just didn't want that to happen again. But what doesn't kill you makes you stronger.
As far as Emmer's case, it's a rare situation, but what we try to do is what's known as selective fusions. Selective fusions is when we have 2 curves, usually there's a major curve and a minor curve. And what we know for a fact is that if we correct a major curve, most minor curves will straighten out and correct spontaneously and not progress. Because we would try to preserve motion segments in the lumbar spine, the lower part of the back, where most of the activity of the spine or motion of the spine is performed, we try to look at the spine and see how few vertebral bodies we can fuse, and usually try to limit to the thoracic spine, the upper part of the spine if possible. On rare occasions, the spine will go ahead and continue to progress despite straightening the upper curve, and in order to prevent that progression from getting worse, we'll go ahead and we do what's known as an extension. We'll go ahead and add 2 or 3 more vertebrae below the fusion, and then go and fuse that mass so that the lower curve will not progress. And we try to catch that very early, and that's why we see the frequent post-operative visits, because if that goes on too long, we have to extend more vertebral bodies, and we try to preserve as many motion segments in the lumbar spine as possible to prevent arthritis in the lower spine later on. In Emmer's case, she had progression in the lower curve, and so we had to add a couple of vertebral bodies in order to stop that progression and preserve the motion segments in the lumbar spine. It's important to understand, though, prior to the new instrumentation we use now, we always used to do both curves, and in those situations we found that as the children got older, that they would develop more problems with their lower part of the spine. So by going ahead and doing this selective fusion, the overwhelming majority of the children don't need to have their lumbar spine instrumented and are doing much better long-term as far as their spine health. With regards to the second surgery, it's a very uncommon situation. I've had to perform that surgery less than 5 times in my career where we've extended the fusion. So though it's a potential risk, it is very, very small.
The second surgery obviously wasn't fun, but it was a lot better than the first one. There was no complications. I was walking the first day or the second day, I woke up and there was no bladder problems, there was no medication problems, and it just went a lot smoother. I was sitting up the day after the surgery. And walking that day too, up and down the hallway with little rests. They didn't put entirely new rods in, they just extended my old ones a little bit. I went home 3 days after my surgery, which was actually on Easter, so it was a nice holiday. The recovery went a lot better because I knew what had to be done. And for example, I took a shower by covering my scar with a garbage bag and a lot of tape rather than laying down on a lawn chair on my deck and using a watering can to wash my hair. And here I am, 6 months later. I'm cleared, back in sports, and everything's fine.
Well, I would like to say that I was surprised when Dr. Rieger gave us the news, but I wasn't. I had been taking Emma to all of her appointments ever since her diagnosis, and deep down inside, I knew her spine wasn't getting any straighter. And when he told us the news, I felt that even though I wanted to burst into tears, I had to keep my composure for Emma's sake. When I looked over at her face and she was ghost white with tears streaming down her face, it broke my heart, and I would have given anything to be in her place. It wasn't until later on that night when I went to bed was when I was able to finally cry for Emma.
The most difficult time for me during the surgery was the waiting. At first I followed Emma into the surgical room where there was countless people, strangers, doctors, interns, people I never met before, all there to assist Emma. And at first I saw her laying on her back with the look of wonder, not knowing what to expect. My biggest fear was I was her protector, her father, and I had no control. And when we talked as she went out and under anesthesia, it was very surreal. And then the waiting began. Every minute seemed like an eternity, wondering if we would get some news. In a strange place, somewhere in Manhattan, waiting to hear if my daughter was okay. It was a struggle.
I was nervous for Emma because I didn't know how she was going to handle it, and it was hard for me to go in the hospital and watch her sit in pain. And I was also nervous because I wasn't really sure what was going to happen, and it was kind of a big deal.
When I found out Emma needed surgery, I started crying too, because her pain is my pain. And you know, typically siblings have the same sort of experience growing up. Like, they all experience the same kind of things. Like, my parents got a divorce and we went through that together. But for that, I really felt like there was no way for me to help Emma. And that was the worst part, watching her be in pain, and not just physical pain, but mental pain throughout the whole process of finding out you need surgery, and then the days leading up to it, and then the surgery itself. And it was just hard to relate, especially when you've been able to relate your whole life to one other person. The best thing you can do is to be there mentally as much as you can, because you can't take away the physical pain, but you can make it easier on them mentally.
One thing I think parents should try to prepare themselves for is how their child reacts to pain. I was pretty surprised on how Emma reacted. I thought for sure she would want to be listening to her music and watch TV and, you know, have her family around her laughing and joking and trying to take her mind off the pain. And Emma wanted dead silence in the room. Even when we were all there, she just laid quietly. And it wasn't until everyone left when she could I could see her physically relaxing. So you need to be prepared for that, and whatever your child wants or however your child wants to handle it, I think it's important to take that into consideration. If they don't want visitors, don't have grandma and grandpa come, or aunt and uncle. If they want people around, then great. But I think that's something that every parent should really think about beforehand and be prepared that it might be something completely different than what you're expecting.
I didn't really know what to expect going into spinal fusion surgery, as I've never even had surgery before. And I asked my doctor questions, I asked everybody questions, but I just felt so alone, like I was the only person going through this. But that's not true. A lot of people have had spinal fusion surgery. And I even remember going online and looking up the surgery and to find what other people have to say about it, but all I found was a video of the actual surgery, which I don't suggest watching.
So what I'd like to add here is that as far as the surgery goes, it's a very big surgery that impacts the family and most importantly the patient. The family generally asks a lot of questions, meaning that the parents ask the question, but the most important person in this process is the patient. And a lot of times the questions that you don't ask are the ones that you should be asking. So I encourage the patients who the surgery is being performed on is to ask the questions. We are there to serve you and to make sure that your health is the eminent and most important part of this process. So the more you know, the better you'll feel and the easier it is for you to get through the process. All physicians, all nurses, all physical therapists should be willing to answer any questions, and I would encourage you to ask any questions, even the ones you think that are stupid and shouldn't be asked. There's no such thing as a stupid question or a question that should be asked. Surgeons have gone through this process of having surgery on themselves, and the nurses have and the physical therapists, and we ask questions, and we know there's no question that we should not be able to ask our healthcare provider, and you should know the same. Ask the questions. Knowledge is important. Knowledge is power, and I wish you success with the surgery.
I wish I had known what I was in for. Like, I wish I had known the pain that I was going to be feeling, the torture recovery was. I wish I had known all of that, and that's why I want to share my story. Dr. Rieger's office, my doctor, has called multiple times with kids who were getting this surgery, who wanted someone to talk to who understood. And I gave them my number, but I guess they were too weirded out or scared because I never heard anything from them. Watching this video, you should have a better idea of spinal fusion surgery and what to expect if you have to get this or know someone who has to get this surgery. But if not, if you still have more questions, feel free to ask me. And if you have any questions at all or need my number or need to talk, I would be happy to help you. Thank you, and I wish you the best of luck with your upcoming surgery.